Autoimmune Awareness Month is recognized every March. It's the same month as Women's History Month to draw attention to and encourage better understanding of an issue that affects 1 in 5 U.S. residents. Of the more than 50 million U.S. residents who have one or more autoimmune diseases, 75% are women. 75%. Intersectionality matters. This is not only a health issue, it's a women's issue, it's a race issue, as some of the autoimmune diseases are much more likely to appear earlier and in more devastating forms in communities of color. And I'll talk a little bit more about that later. Most of us have heard of autoimmune disease, but we have a lot to learn about them. The Autoimmune Association explains that autoimmune disease is a broad category of related diseases in which a person's immune system mistakenly attacks the tissues and organs it was designed to protect. Your body attacking itself. While we have much left to discover about the causes and treatments of autoimmune diseases, there are several things we know for sure. We know that they are chronic and that currently none have a cure. We know that the impact of an autoimmune disease on a person's life can range from mild to life-threatening. My better half, Michelle Jawando, has lupus. In our household, we know the stress and confusion that can occur before a diagnosis when the cause of the symptoms are unknown. We also know the effort that it takes to find effective treatment once a diagnosis is established. We know the drain on our energy and the fear for our loved ones' well-being. I'm sorry. We also know that life, thank you, with autoimmune disease can be full of purpose and joy, and that people who get a diagnosis that have proper treatment, we have a pamphlet here more about it so you know how to, can live a completely full life, not dominated by their symptoms. So those who have come up today, and many more I'm sure watching at home, have experienced this themselves or had to care for someone dealing with an autoimmune disease. They understand exactly what I'm talking about. Lupus in particular affects an estimated 1.5 million people in the US and about 5 million worldwide, with 90% of them being women. Most people with lupus develop the disease between the ages of 15 and 44, and women of color are 2 to 3 times more likely to develop lupus. There are 4 forms of lupus, but multiple studies have found that BIPOC women develop lupus earlier and have worse outcomes than their white counterparts. So we must continue to build awareness about all autoimmune diseases, educate ourselves, advocate for change, and research money, and rewrite the story of what it means to have an autoimmune disease. I'd like to invite just one of our speakers, Lauren Cornegay, to talk. She's the executive director of Endo Black, Inc. She has made it her mission to create a community of women to improve social support and health outcomes for African American women, specifically as it relates to autoimmune diseases. Lauren, thank you for joining us today and for your nonprofit and work that supports thousands of women across the DMV. And I'm also, do you want to speak? You don't have to if you don't want to. Okay, you'll say hello. And then Dr. Ashford is going to speak very briefly about her role as county's chief public health officer, and then we'll read the proclamation. And thank you for bearing with me.
Hello, everyone. As he stated, I am Lauren Cornegay, founder and executive director of Indo Black. I am so honored to be here to support this initiative, to support this proclamation. It means a lot to me. It means a lot to our community. Though endometriosis is not listed as an autoimmune disease, what happens when we are diagnosed with endometriosis, we are at a greater risk of having autoimmune diseases such as lupus, sickle cell anemia, and many other things. So supporting this, getting behind this, making sure that there's awareness on this, especially for the disparities and the demographics. We want to make sure that people are learning more about this so we can find cures and we can find resolutions so that others are able to live their life vicariously, and also just be able to live their life with their family members the way that we're supposed to be able to. So I just want to say thank you again for this opportunity, and we just have to continue to raise awareness and support. Thank you.
Thank you so much. I'm honored to be here representing the county's Department of Health and Human Services. DHHS administers several programs that support individuals living with or affected by autoimmune disease. As you probably are aware, screening and then treatment is critically important, and the lack of insurance or your insurance status should never stand in the way of that. So Montgomery Cares is a program that provides insurance for individuals who are uninsured to allow them to be able to get screened, get access to providers, labs, x-rays, access to specialists to help either identify and or support the treatment of their autoimmune disease. Our home care program also provides personal services for individuals, adults that have underlying health conditions, such as autoimmune disease that might impede their ability to perform activities of daily living, and provides them other supports they need. We also have the respite program. So if an individual caregiver or family member is caretaking for an individual with autoimmune disease in an unpaid fashion, it provides services and some respite support to help them recover, and support to families who are taking care of their loved ones. We know that caretaking is a selfless act, and we want to make sure that our caregivers are supported. So you can receive additional information about any or all of these programs by calling us directly at 240-777-1603. Thank you.
Thank you, Dr. Ashford. We always like a good number to hotline. I'm going to ask Councilmember Dawn Lukely to come up and maybe read the proclamation with me if she wants to share anything before that.
Oh, sure.
Yeah.
Yes, so I have been living with an autoimmune disease for 19 years. And I just want to say thank you to Councilmember Jawando, because having support at home makes all the difference in the world. And to everyone else up here representing our health providers and public health service, making sure you get treatment early is critical to the success of your outcome, so that you can stave off the progression of the diseases. And I like to think I live a pretty full life. I like to think I get quite a few things done. You know, just sharing, though, that I had that disease at that time, some people questioned why I would even bother going ahead and having children. And I think that that's a horrible thing for people to say. And so the more we talk about these things openly and honestly and share our own life's journeys, the more we reduce misunderstanding and misinformation, and the more we help people understand how to be helpful to us instead of raising barriers or looking at any of us as though we are less than. So thank you for highlighting this and raising this awareness, and take it away.
Thank you, Councilmember Lukey. Whereas Autoimmune Awareness Month, celebrated every March, is dedicated to enhancing understanding and recognition of autoimmune diseases. These diseases occur when the immune system meant to protect our bodies from harm mistakenly attacks its own tissues. Most autoimmune diseases are chronic and do not have a cure, so treatment mainly focuses on slowing disease progression and, do you want to join me? Come on in.
Whereas over 100 autoimmune diseases have been identified, including rheumatoid arthritis, lupus, celiac, type 1 diabetes, psoriasis, and multiple sclerosis. In the United States, 1 in every 5 residents has an autoimmune disease, and 75% of those affected are women. According to the National Institutes of Health, it is the 3rd most prevalent disease category after cancer and heart disease. At least 4% of the global population is affected, and rates are increasing. And
whereas autoimmune diseases are not contagious or infectious, they can be visible or invisible and can cause a disability. Genetics and environmental factors such as pollutants, medications, diet, viral infections, and stress are linked to autoimmunity. Autoimmune disease symptoms can vary and change over time, complicating diagnoses and treatment. And
whereas advocacy, awareness, education, and research are necessary to improve the lives of the millions who live with autoimmune diseases and prevent future impacts. Montgomery County residents can better protect their health by becoming aware of the risks, signs, and treatments for autoimmune diseases. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland celebrates the month of March as Autoimmune Awareness Month. And the
Sure. And be it further resolved that the county encourages all residents to do the same. Presented the 12th day of March, 2024, signed by myself, Council President, and on behalf of all council members. Thank you very much. We'll take a picture.